Good evening, everyone, once again. My name is Basil Choma. I'm here to discuss on the types of seizures, mechanism of action, and uses of anti-epileptic drugs. What are seizures? A seizure is a surge of abnormal electrical activity in your brain. The most recognizable symptoms of a seizure are a temporary loss of consciousness and uncontrollable movement, that's convulsions. Not all seizures look the same. You might stop what you are doing and stare off into space for a second. You might jerk your arm or feel your muscles twitch. You might only have seizures in your life or have multiple seizures per day. Your experiences with seizures can be very different from someone else's own. There are many possible causes of seizure because a lot of things can interfere with your brain's typical electrical patterns. A seizure is a sudden change in behavior, movement, or consciousness due to abnormal electrical activity in your brain. Now, discuss on the types of seizures. We have three main types of seizures. We have the focal seizures, we have the generalized seizures, and we have the unknown onset seizures. The focal seizures, these affect only one side of your brain and body. The symptoms depend on the area of the brain where the seizure happens. As the seizure gets more intense, it can start to affect the other parts of the brain. The most common type of seizure is this focal seizure and named based on the specific part of the brain where it happened. About 60% of people with epilepsy have this type of seizure, which sometimes called a partial seizure. Focal seizure usually consists of motor symptoms or sensory symptoms. Sensory symptoms, others are subjective sensations that occur before focal seizures. Orals include changes in vision, hearing, or smell. An example is smelling rubber. Motor symptoms, head turning and eyes moving to one side with contractions of the limbs, and on one side is a common presentation. These are repetitive movements. It can be lip smacking, chewing, swallowing, eyelid fluttering, feet shuffling, or picking movements. We have the generalized seizures. These happen when the nerve cell on both sides of the brain misfire. They can cause a variety of symptoms such as muscle stiffening, falls, and jerky movements. There are six main types of generalized seizure. We have the tonic-clonic, the clonic, myoclonic, absence, and atonic seizures. The tonic seizures, also known as the grand mal seizure, present with continuous stiffening of the body for 10 to 20 seconds, followed by rhythm jerking. Tonic seizure produce constant contractions of the muscle. The body stiffens for a prolonged period of time. The muscles most commonly affected are the neck, the shoulder, the hips, and the trunk. Clonic seizure involves jerking of the muscles rhythmically. Myoclonic seizure involves such short contractions of the muscle in either a few areas of the body or through the whole body. Absence seizures can last about 10 to 15 seconds usually. It is characterized by a sudden brief episode where a person is unaware of what is happening and does not respond. Atonic seizures involve the loss of muscle activity, causing a person to drop abruptly with their muscles limp. This is called a drop attack. That means atonic seizures can also be called a drop attack. Now, let's come to the third type of seizure, unknown onset seizure. When the beginning of a seizure is not known, it is called an unknown onset seizure. This diagnosis is often given if no one is around to witness your symptoms when your seizure starts. Later, after more information is collected, your diagnosis might be changed to a specific type of seizure. Mechanism of actions of seizure. Focal seizure is mainly caused by the malfunctions of ion channels. External stimuli like infection, tumor, or cranial injury, adenosine, and increase the permeability of blood-brain barrier, which results to excessive influx of neurotransmitters into the hippocampal region. The biophysical mechanisms underlying epileptogenesis and generation of seizure remain to be better understood. Neurofunction by either being excited or inhibited. Excited neurons fire electrical charges, while inhibited neurons are prevented from firing. The balance of the two maintains our central nervous system. Seizures that occur after a brain injury may be due to the brain adapting to injury, that's neuroplasticity. This process is known as epileptogenesis. There is loss of inhibitory neurons because they die due to the injury. The brain may also adapt and make new neurons connection that may be hyperexcitatory. Now let's come to anti-epileptic drug. What are epilepsy? Epilepsy, also known as a seizure disorder, is a brain condition that causes recurring seizure. There are many types of epilepsy. In some people, the cause can be identified. In others, it may be unknown. Epilepsy is common. It is estimated that 1.2% of people in the United States have active epilepsy. Now, let's talk about the common anti-epileptic drugs. That's the AEDs. We have Keppra, that's levetiracetam. We have dilatin, that's phenytoin. We have tegretol, carbatrol, that's carbamazepine. It's a common drug. We have the depakote, that's depakin. Is also known as valproic acid. We have neurotin. We have phenobarbital. We have mysoline. Keppra, that's levetiracetam. The brand name, US name is Elepsia XR or Keppra. Is approved for adults and for children ages 1 month and older. It is used for the prevention of seizure for people who have partial epilepsy, generalized epilepsy, and myoclonic epilepsy. Side effects: headaches, tiredness, dizziness, depression, infection, weakness, aggressive behaviors. It can be in tablets and it can also be in suspension and solution. We have dilatin. The generic name is phenytoin. The brand name is dilatin. Is an anti-epileptic drug, also called an anticonvulsant, used to control seizure. What are the common side effects? Slow or uneven heartbeat, chest pain, fluttering in your chest, dizziness, fever, chills, sore throat, swollen glands, etc. We have carbamazepine. It's a common drug known in Nigeria and even in other countries. Carbamazepine is sold under the brand name Tegretol. Among others, is an anticonvulsant medication used in the treatment of epilepsy and neuropathic pain. It is also used to treat bipolar disorder, the carbamazepine. We have depakin, the generic name valproic acid. Is an anti-epileptic drug used to treat various types of seizure disorder. It's sometimes used together with other seizure medications. It is available in the generic form, that's valproic acid. What are the side effects? Diarrhea, constipation, upset stomach, drowsiness, dizziness, weakness, hair loss. We have neurotin. Generic name gabapentin. The drug class, GABA-aminobutyric acid analog. Neurotin, also known as gabapentin, is a medication primarily used for neuropathic pains and seizure. It is effective for conditions such as nerve pain caused by shingles and is classified as anticonvulsant and anti-epileptic. We have phenobarbital. The common brand name is Luminal or Cezabin. We have mysoline. Generic name Pramidol. Is also known as an anti-convulsant drug. So in general, in conclusion, seizure. Normally, your brain sends signals through your nervous system in a predictable, organized way. But sometimes, this signal gets mixed up and cause a seizure. You might experience a seizure as a sudden change in how your brain works. It's like a burst of electrical activity that disrupts your normal brain function. It can cause you to feel confused for a short time, have uncontrollable movement, stare blankly, or even lose consciousness altogether. Seizure can happen for many reasons and they can be mild or severe. Thank you.
Please clap for her, please. Clap for her. Clap for her, please. Wow. I'm impressed. Thank you very much for this presentation. Thank you very much. You did a good job. Thank you very much. All right. Without wasting time, I think this will be the last presentation for the day.
Yes, sir.
All right. Thank you very much. Thank you very much.
Thank you, sir.
All right. We've come to the end of our presentation for today. So I want to thank everybody that presented today, and also thank those that are yet to present. We continue our presentation next week, Saturday, all things being equal, and by the special grace of God. Our fans, the audience, thank you for being with us from the beginning till now. Thank you for being with us. Please share, subscribe, like, follow. Invite others to join. Next week, Saturday, under normal circumstances, 7 a.m. or the day about, we hit it from between 7 and 6 p.m., all things being equal. And God willing, is going to be a success. All right, see you next week. God bless you.
God bless you. Thank you. Thank you, sir.